Hello, everyone. My name is Dr. Wala Elizabeth from Nairobi, Kenya. I want to relate how this connects to me as an individual. One, I'm a woman. Two, a Black woman. And three, a Black African woman who's in the STEM field. And in these parts of the world, it's very, very at least in our generation now, we're seeing more of the women coming up, rising up to some of these STEM professions, is that we've been taught that it's a man's world, and we should be doing other more maybe artsy kind of professions, which is fine in terms of the arts professions, but then we need to encourage more women to step up and to come into these fields. The other thing that I feel drives my passion is that as women, we do undergo or we do experience many things throughout our life cycles. There are transitions. We're always in one transition or another. So we are from the preconception stage where we run the risk of, especially the African woman who runs the risk of dying. An African woman runs the risk of dying at childbirth 4 times more than someone out in another country that's not in Africa. The other thing that we experience are issues to do with fertility. So an African woman is judged by her capability to bring forth children. And sometimes, many a times, the blame is put on the woman when children don't come forth. And so they have a burden of proving that they are capable of living up to the name of being a woman, which is very unfortunate. So we do have a number of cases, and I'll pick a couple of my friends who are basically your middle class career women, married over 10 years, no child, and has really tried to get to understand why they're not able to bear children. Many of them are suffering from conditions like fibroids, which are basically growths in the uterus, or they're having issues like endometriosis, which is a condition where a woman suffers extreme pain during her menstrual cycle, because you have uterus tissue outside the uterus. And if you look at many of these conditions, if you are in a Western facility, there are many there's access to diagnostic care where, beforehand, the reproductive or the sexual health of the woman is closely monitored right from teenagehood. There's exposure about what to expect during puberty, during adolescence, during, being a young adult woman, all the way to menopause. So these are discussions that are they're almost taboo-like here. And when something goes wrong, we find that the women, because they're facing stigma, discrimination from the society, they hold back and they get into their shells, or they get into depression. We have seen relationships breaking because of many of these issues. Yet if we had very, good diagnostic systems, if you have these genetic testings of what are your risks of carrying, let's say, breast cancer gene, what are your risks of having fibroids, is it running in the family? These are the kind of discussions that can be had easily and then managed quite early, because I see a lot of women presenting to the health facilities when maybe the situations are not redeemable. I also see my doctor colleagues, so I'm no longer in practice, but I interact a lot with my colleagues, and you can see the frustration they have when they know that the theoretical part of the conditions, but then their hands are held because they're not able to carry some of these tests that would be almost standard in the West. So I'm leaving for a vision or a future where every woman, every girl in this continent would have access to the highest level of care. And for us, it's enshrined in our constitution in this country, but then that is just on paper. So how do we push the paper conversations from just, what sounds good to hear to what is really practical and tangible to a woman in the village who's requiring some of this expertise and who cannot afford. I also see a lot of exports or rather samples being taken out of the country for some of these tests, yet we know that it is possible with the right kind of equipment, sensitization to people to know that to go for genetic testing, to make it routine, is that it's possible to have things that are, or rather tests that are done in-house, tests that are done, the turnaround time is short enough for people to make decisions. And also the costs would also be lowered because the logistics bit has been removed. So for me, it's personal because, as I mentioned, I'm a woman. I have children. I have girls, 3 of them, triplets, whom I would want to say that in their generation, as they become young women, they are now turning 12 years, as they become young women, that it should not be a matter of access to them, but it should be a matter of choice, of options available to them within the spaces that they operate. It is also a matter of them knowing that there is expertise available, that there is therapy available, that is there are diagnostics available for them to be able to live to their full capacity.